Can tau positron emission tomography help inform the risk of Alzheimer's disease progression? Is more screen use over time associated with worse mental health in adolescents? This and much more on today's episode of the JAMA Editor Summary. Hello, and welcome to our listeners around the world. Today is Friday, June 20th, 2025. I'm Dr. Kirsten Bibbins-Domingo, the editor-in-chief of JAMA and the JAMA Network. For this episode, I'm joined by JAMA Deputy Editor Dr. Preeti Malani. Hello, Preeti. Let's get started.
Hi, Kirsten. Let's talk about the research article by Dr. Moscoso and colleagues. Their cohort study focuses on neurocortical tau neurofibrillary tangles, a neuropathologic hallmark of Alzheimer's disease. The authors explain that the only biomarker approved for clinical use to identify neurofibrillary tangles is tau positron emission tomography, or PET imaging. They wanted to learn more about how tau PET could be used in a clinical setting. They analyzed the frequency of tau PET positivity and its associated risk of cognitive decline in a longitudinal study from a convenience sample comprised of more than 6,000 participants. They reported some interesting considerations for tau PET scans. Tau PET positivity occurred in a non-negligible portion of cognitively unimpaired individuals, and the combination of a positive tau PET scan and a positive amyloid beta PET scan was associated with a high risk of clinical progression of disease over 5 years.
There's also an article by Dr. Bohr and colleagues who estimate mortality rates and life expectancy for U.S., American Indian, and Alaska Native people, comparing self-reported classifications and those from death certificates. The authors report a large discrepancy in life expectancy, with far lower mortality rates based on death certificate classifications compared to data where individuals self-report their identity. The authors conclude that racial misclassification on death certificates likely results in underestimating mortality in official statistics for this population.
In the accompanying editorial, Dr. Owen and Toby explain the importance of this study, stating that the study sheds new light on a critical flaw in health statistics. The editorialists emphasize that the study's authors characterize their findings as an example of statistical erasure. That is, the invisibility of American Indian and Alaska Native people in data due to either underreporting or omission.
There's been a lot in the public discussion with concerns for screen time use, particularly among U.S. youth. This week, JAMA published an article on addictive screen use and mental health in U.S. adolescents.
That's right, Kirsten. This is a cohort study by Dr. Xiao and colleagues. They looked at data over 4 years from a sample of over 4,000 participants with a mean age of 10 years. Instead of looking at total screen time for only one point in time, the investigators were able to look at longitudinal addictive use trajectories of social media, mobile phones, and video games. They also measured the trajectories' associations with suicidal behaviors and ideation and mental health outcomes. The authors found that high or increasing trajectories of addictive screen use were common in early adolescence and were associated with suicidal behaviors and ideation and worse mental health.
In an accompanying editorial, Dr. Nagata and colleagues discussed the growing concern around addictive screen use among adolescents and its significant impact on mental health. The editorialists commend the authors on their use of latent class linear mixed models that allow researchers to explore changes in addictive screen use over time, which is a novel feature of this study, and the association of this pattern with mental health.
JAMA published a research letter this week by Dr. Tran and colleagues. They investigated the effect of the Mainstreaming Addiction Treatment Act on pharmacist-prescribed buprenorphine. Their cross-sectional study found that this act, which allows pharmacists to prescribe buprenorphine directly or through a collaborative practice agreement, was associated with a significant increase in the number of prescriptions prescribed by pharmacists from U.S. retail pharmacies. There's a viewpoint this week by Dr. Asturias and the other 16 former members of the Advisory Committee on Immunization Practices, or ACIP. The authors of this viewpoint expressed their concerns about the abrupt dismissal of ACIP members They also emphasized the role that routine vaccinations play to keep the U.S. free from preventable illnesses. Dr. Talbot and former members of the CDC's Healthcare Infection Control Practices Advisory Committee contributed a viewpoint this week as well. They described the recent termination of this committee and what this means for effective infection prevention within the U.S. healthcare system.
And Professor Larry Gostin and colleagues write about the rescinding of the COVID-19 vaccine recommendation for healthy children and pregnant women. They discuss scientific evidence in support of vaccination and how these changes could restrict access to affordable COVID-19 vaccines. Dr. Brunner and colleagues have a viewpoint about benzodiazepine prescribing. Their discussion centers on the Joint Clinical Practice Guideline on benzodiazepine tapering, recently commissioned by the Food and Drug Administration.
In another viewpoint this week, American College of Obstetrics and Gynecology Chief Legal Officer and General Counsel Molly Megan explains why efforts to clarify language in abortion ban laws will not suffice. Instead, the laws should be repealed.
JAMA published a collection of helpful clinical content this week. There's a review on adrenal insufficiency in adults. Dr. Vaidya and colleagues review causes and treatments for primary, secondary, and glucocorticoid-induced adrenal insufficiency. The accompanying JAMA Clinical Reviews podcast is filled with helpful information.
Well, is there anything else you would like our listeners to know about adrenal insufficiency?
What I would emphasize, assuming the listeners here are largely general clinicians, is one, keep it simple. If you suspect adrenal insufficiency, you don't have to be fancy or do stimulation tests or ask your patient to get a morning cortisol, ACTH, and DHEAS. These values will likely give you the answer you need.
In a new article by Dr. Liu and colleagues in the JAMA Guide to Statistics and Methods, listeners can learn about tipping point analyses and how this analytic technique can be used to understand the potential impact of missing data in a study.
Globally, heat-related illness is a concern. The JAMA Insights on Occupational Heat-Related Illness by Dr. Spector and colleagues considers how hot environments and climate change are having an effect on workers' health. This week's JAMA patient page explains swallowing problems in people with advanced dementia. It also explores different feeding strategies and the role that speech-language pathologists can play in keeping patients safe and nourished.
We invite you to read the latest JAMA medical news at jamamedicalnews.com or click the link in the show notes to find the latest articles in clinical medicine, biomedical research, public health, and health policy written and researched by our outstanding JAMA medical news team.
Thank you for tuning in to hear what's new this week at JAMA. These highlights were brought to you by Dr. Preeti Malani and me, Dr. Kirsten Bibbins-Domingo. This episode was produced by Daniel Morrow, Shelley Steffens, and Dr. Krista Roberts at the JAMA Network. A link to this JAMA content can be found in the episode's show notes. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. And thank you for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.